May is Mental Health Awareness Month. The state issued an annual proclamation today highlighting the need for more equitable care. The state wants to improve access to underserved populations like people of color and those living in rural areas. All month long, 9 News will feature stories on mental health and the resources available like the I Matter program. It's designed to help kids affected in part by the pandemic. Elizabeth Owens with I Matter joins us right now. We've just been chatting a little bit about this program. You got it started during the pandemic itself and already have helped, what, 2,400 kids?
Yes, 2,400 kids have received at least one therapy session through I Matter. And it came from legislation last session that was really a result of the pandemic. And we launched it in October, just trying to help as many kids as possible with free therapy.
And we've talked about this. We know our kids are suffering, and they've been suffering before the pandemic, but the pandemic really highlighted some of the issues and the isolation and the struggles that young people are facing.
Yeah, absolutely. And that's what we've heard anecdotally is that, youth had to find new supports. They lost their typical support system, whether that was school, after school activities, their friends. And so I Matter has been able to help them talk through some of that.
Yeah, it's that routine that we always talk, it doesn't matter, little ones to older ones, routine matters, and seeing the same people and conversing, having a peer group. But you're seeing probably largest group. What age bracket are the largest groups seeking help right now?
Yeah, so we've had parents of youth ages 4 to age 21 sign their kids up, or the kids have signed up for the program. But we are seeing more of those older kids within that range use the program.
Yeah. When you talk about young ones, you have a young one. I mean, when you think about the pandemic, part of the struggle is the fact that there are a large group that can't be vaccinated, and you're having to keep them away from people. I mean, that's part of the struggle.
Yeah, it's so interesting. My kid is like, a restaurant? What's a restaurant? You just get so excited about little things like that probably when we were toddlers, wouldn't have been as big of a deal. Yeah, absolutely.
Yeah. How do people find you? I know that there are a variety of ways how do people get to you?
Yeah, so we're running digital ads all across the state, as well as things like paid poster distribution in areas that have less broadband availability. And then we have staff dedicated to doing outreach on the program. So, coming to a school group, coming to a community organization, talking to parents, talking to students. And so we've had hundreds of school districts throughout the state request materials. So we know that our school partners are really engaged on this.
And I know we mentioned this is a lot of the underserved groups you're trying to reach in rural areas where they feel isolated just by being rural. So hopefully if there's somebody out there that's seeing this, what would you tell them? Get out there, reach out, somebody, the help is there.
Yes, it is always the right time to reach out for mental health care, and this is free. You can take a short survey and sign up immediately and get connected to a therapist who can help you. So we've tried to remove all those key barriers to receiving therapy, so we're hoping as many youth as possible use it.
Must make you feel good to know you're doing this.
Oh yes, any kid we can help is great news for us. We're super excited about this program.
Yeah, let's send a healthy generation mentally, physically out there in the world, right?
Yes, that's good news for all of us, right? Yes, absolutely.
Elizabeth, thank you. Again, it's I Matter, so we really appreciate all the good work you're doing.
Thank you so much for having me.
Thank you.